Yo, what up? It's a tip of the week, and today we're going to discuss how to manage a patient with post-op pain.
If you love this tip and want to go deeper, check out this course. I can describe this course in one simple phrase: surgical coaching in your office. Concierge Surgical Coaching is a PACE accredited with the Academy of General Dentistry. This course offers an innovative approach to surgical and implant dentistry that can help you achieve your goals. Concierge Surgical Coaching gives you affordable prices, hands-on training, how to handle complications, step-by-step methods for best results, and how to discuss patient finances and your return on investment. Gain the skills you can use now on your patients for tomorrow that could achieve your production, clinical goals while never booking a flight for education again. Start earning CE today. Enroll at jaredwdds.com.
All right, guys, if you haven't checked out the book, How to Get Any Patient Numb, get your copy now. It's free at this juncture. However, I can't tell you how long my team is going to have it up for you. So click the link below, get your free copy. Stop walking around the office with needles, doing one of these and sticking it in people's eyes and doing silly stuff like that. Don't do that, guys. Don't push a bunch of medication on a patient, give them overdose on these medications. It's not necessary. There's a perfect way on how to get any patient numb, and it's in the book. Check out the link, smash the link, do whatever you need to do to make it happen. All right, let's get back into it. So, a couple things that you need to do in order to manage a patient who's in pain. Number one, breathe. See how easy that was? That's all you got to do. Not quite. Breathe. Most patients just want to make sure that they are reassured that their healing process is going the way in which it should. I always teach principles on this channel because principles will always lead you to a promise. And even when you follow the principle to the T, you are still not guaranteed those results. And so you always want to let the patient know, we're going to do the best we possibly can for you. However, things happen. And you always want to go over that before, during, and after the procedure. So when it comes up, the patient will be fully aware of, okay, Dr. Williams told me that these things were going to happen. And that's not going to prevent them from being pissed off if something does. But at least that could be something that's documented. They've heard at least 3 or 4 times from you and your staff and your front office. And at least they'll be more amenable to work with you to get through their challenge. Number 2, ask the patient open-ended questions. Ask them questions such as, how did you take your pain medication or your antibiotic? What did you do after the procedure? If you say to them, did you take your pain medication 4 times a day, 3 times a day, or 4 to 6 hours as needed for pain? Did you rinse and spit after 72 hours? Did you take the antibiotics 3 times a day? If you say it like that, they're going to be like, yeah, we did that. We did that. Knowing good and well most patients may not have. But you want to ask open-ended questions. You essentially want to be like a detective, taking in information, asking a few questions, but letting the patient speak to you about everything that happened. Because sometimes after procedures, individuals are just like, I don't know what the heck had just happened. There was a lot of stuff going on, blah, 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 blah. I kind of just did whatever. And so when you're getting this information, the patient's telling you what's happened after these open-ended questions, they'll either remember what they could have done better in order to alleviate some of the challenges that they're already having. So keep that in mind. Ask open-ended questions. 3, ask the patient to send you a picture. Not that type of picture, guys. But the type of picture to where if you're not in your office and the patient is calling you on a Saturday night saying, hey, doc, I'm in pain, you could just have the patient take a selfie. But the selfie that they should take is by covering over their eyes and taking that photo. By doing that, what you're able to do is evaluate any abnormal changes. Like if they said, hey, I got swelling, you could have them cover their eyes, take that picture, and just kind of get an idea of what's going on. Because most patients' thoughts of swelling and bleeding and all that stuff is completely different than ours. And so you just want to reassure them again. So take that picture, cover over their eyes so that there aren't any distinguishing features that are given away. So in the event your phone gets stolen, lost, or somebody gets into it that you really didn't want, when they go over this picture, they won't be able to know who the heck it is. And then you're HIPAA compliant. At least I think so. But that's at the end of the day, it's just principles, guys. Keep that in mind. Cover their faces, and you should be good. The next thing you want to do is this, which is the bonus. Don't give the patient high doses of medication, the big guns. The reason why is this. Here in America, I know there's individuals watching from all around the world. Here in America, unfortunately, there is an opioid or pain medication epidemic or pandemic for that matter. In the sense that patients are going crazy for pain medications. Now, it's not everybody, guys, but there's more patients out there that are seeking than what we like. And so as a clinician, I don't know what type of patient that's sitting in front of me or I'm about to treat. And I want to prescribe medications that are going to fall within the bell curve. Now, there's going to be individuals that are outside of the bell curve, but you want to give those medications that's just enough that's going to get them to where they need to be so that you don't inadvertently cause any seekers yourself. And so by giving them a medication that's within that bell curve, in the event you get that call on Saturday night or you're doing something and it's unexpected, what you can then do is this. You can prescribe a little bit more. So there you have it, guys. Those are the 3 tips plus a bonus to how you can treat your patient or manage your patient when they have post-op pain. So once again, I'm Dr. Jared Williams, and my focus is for you to smile after surgery. Make it a great one.